Hello friends. Uh, Today actually I'm on a holiday, so I thought I'll make a video for you all guys. And because I don't have a studio, so there may be some noises which you can hear, but do bear with me. This talk is about what you should do after your MSOBG or DNBOBG or your DGO. Okay, a lot of juniors who complete their MSOBG and then do ask me what we should do. Should they pursue fetal medicine? Should they pursue laparoscopy? Should they pursue IVF? Everybody is now keen to go for specialization. Nothing wrong with that. But I just want to give you, with my experience of more than 15 years clinical practice, some guidelines, and from there, of course, it is you who has to decide. Okay, so I'll be giving take-home messages uh, at the end, and please do share with your friends who have just completed their MSOBG or DNBOBG, and hopefully this video will help you all. You can listen to this by 1.5 speeds also, because I'll be speaking a bit slow. Okay, so first of all, most of our medical colleges and DNB training centers, most I say, are overburdened with obstetrics. So many people will not have enough exposure in terms of gynecology, ultrasound, fertility, and laparoscopy. And this is true with most. There may be exceptions where there is a comprehensive training, but still obstetrics takes over most of the other branches. But what happens is, the moment you come out of MSOBG, everybody wants to go to specialty. Now you don't have a skill set already, which is already you have, where you can go and suddenly subspecialize. Okay, so let me assess one by one. What are the factors which you should consider before embarking on a specialty? Now, first of all, what is your temperament? Like, for example, if you want to go to oncology, do you have temperament to break the bad news, to counsel the patient, to carry them through their relapses, through their remissions, everything? Do you have that surgical skill set to be a good oncosurgeon? Or if you become an IVF specialist, do you have that sound endocrinology background where you can build on? Are you good at patient counseling? Are you good at choosing your patients, patient selection, everything? If you want to do laparoscopy, do you have that basic surgical knowledge, and do you have aptitude to learn for long hours? Do you like to work even in emergency, or do you like only 9 to 5 kind of job? So what is the step number one in choosing your specialty is know yourself. You sit down and write, what do I want? Do not just imitate, and just because you see one successful laparoscopy surgeon, one successful IVF specialist, one successful oncosurgeon, and try to imitate them. No, they have their story. If you sit with them and ask them, they will tell their story. What was their struggle? How much time did they take to learn the trade? How much time did they take to master what they are today? They'll tell their story. Just because you go to 15 days training, 30 days training, you don't become one. Okay, so sit down and write. Do you like to be in action 24/7? Are you ready to go and do freelancing? Are you ready to take all the stress of surgical branch or whatever? That will decide whether you want to go for oncology or laparoscopy or fetal medicine. Okay, so if you like, for example, just giving an example, you like to do a 9 to 5 job, you want to dedicate your time to your family, then fetal medicine probably is a better choice. But remember, as a fetal medicine specialist, you have a ceiling as far as your earning goes, because beyond a point you cannot earn, because in a day you can do maybe 20, 25, 30 scans. Beyond that you cannot do much. So If you are a surgeon, probably you are more, but you have a long learning curve. So depending on what your desires are. Another factor, whether you want to settle in a rural place, whether you want to settle in a semi-urban place, or whether you want to go to corporate, whether you want to work in a medical college, all these things would decide what kind of specialty you want to do. So remember, sit down and write what is that you desire. More importantly, I always tell what is your passion. Okay, if you have passion, do you have that kind of a skill set and mindset to pursue the specialty you desire to do? Okay, so considering all this, I would like to consider one by one and then give you some tips and tricks of the trade. Okay, imagine you want to be a generalist. You know what I mean by generalist is, you want to do obstetrics, you want to do gynecology, you want to do your own scans, and you want to do little bit of laparoscopy, and then probably preventive oncology as well. Perfect, nothing wrong. There is nothing wrong to be a generalist. Okay, you can be doing all what you have learned in obstetrics and gynecology in your MS in a enhanced level. Okay, so first, what you have learned in your PG, that is very important, and beyond which you have to learn. Now, some of the skills like doing an ultrasound, good gynec ultrasound, and dating scan, diagnosing an ectopic, diagnosing an torsion, doing your own growth scans, and if you are very good enough, you can even do anomaly scans. There is nothing wrong with it. Okay, if you have good skill. So ultrasound is something which is absolutely non-negotiable no matter what you go, and especially if you want to be a generalist, that is, you want to do everything what you have learned. Great. Okay, you want to set up your practice in a semi-urban place, so learn good ultrasound, learn good skills of general surgery, work with somebody who does high risk obstetrics, and you should have a good team of doctors whom you can refer to or talk to. Okay, in case of an emergency. Okay, you can make a lot of difference in semi-urban and rural areas if you want to practice obstetrics and gynecology together. See, for bigger cases like laparoscopy and other things, you can always call somebody who, now there are a lot of freelancers who will come and operate for you. So there is nothing wrong to be a generalist. You don't have to follow the herd and go to subspecialty immediately after your MSOBG. You work for an year or two in a center where they are doing good ultrasound, they are doing their laparoscopy, they are doing their high risk obstetrics, like that, and then you acquire these skills, enhance your skill sets, and go on practice. There is nothing wrong with it. Okay, and second option is my favorite, that is learning endoscopic surgery. Now remember, now there is officially a level 1, level 2, and level 3 surgical skill sets, right? You all know about it. Now, to what level you want to practice? Now imagine you want to do simple hysteroscopic procedures, diagnostic hysteroscopic procedures, and then probably tubal ligations, and in probably minimal fertility enhancing surgeries. That is level 1. Okay, you want to do hysterectomy and myomectomy and little bit of adhesiolisis vagera, that may be level 2. But you want to do endometriosis, you want to do oncosurgery, you want to do higher bigger, you try doing a TLH, a bigger myomas, doing a lap myomectomy, then that will be level 3 and level 4 skills. So depending on what level you want to learn, you have to put in those many years as a trainee. Okay, now you should ask another very important question, that do you have good basic laparoscopy skills in the first place? Now if you don't, please work for 6 months, 1 year, learn the good surgical skills. Are you able to do open hysterectomy confidently on your own? If there is a hemoperitoneum, maybe because of corpus luteal cyst, maybe because of ectopic, maybe because of post hysterectomy bleed, are you able to do laparotomy on your own and then tackle the problem? Do you have that confidence? If so, then you should start your laparoscopy training. Most of the time it so happens that you don't have a skill set. You go to 15 days 1 month training, they make you do 3 or 4 TLH, you come and start doing, you get into trouble, you don't know how to open the abdomen and then solve the problem, then you are in big trouble. So understand your skill set before going into laparoscopy training. My recommendation to you all is minimum 1 to 3 years of good learning is required to be able to do, you know, level 2 or level 3 surgeries. Okay, so first draw your goal and then find a center where they train you for 1 2 3 years. Don't be in a hurry. Don't think that somebody has gone only for 6 months training and then he's doing TLH or she's doing TLH. No, everybody has their own journey. Okay, I myself has worked for 3 years before starting my private practice. So don't worry about it. You have your time. Your time will come when you are in training. Okay, if you are getting decent stipend, that's all you should aim for. And then if you are willing to put in 1 to 3 years, of course choose a endoscopy surgery, then you can always advance to level 3 level 4 skills. Okay, now another option, fetal medicine. Now fetal medicine is very emerging branch. Now almost every scan, now we are expecting that a fetal medicine should do at least NT scan and a TIFA scan. Okay, so now more and more gynecologists are choosing fetal medicine because not many emergencies are practically no emergencies. You do 9 to 5 job, you do your scans report, and if at all there are few procedures like amniocentesis, coronary villus sampling, you do and you go home. So thereby you can dedicate your family time. You can take weekends off, or you can take a longer breaks also in between by giving appointments and all that. So it gives you that kind of a flexibility. If you are in an emergency branch, probably you don't have that flexibility. But again, fetal medicine, now it has become so vast that you should be able to read so much, understand the subject very well, because very little fetal medicine is taught in our obs-gynae training. So now it has gone to different level. So if you are a academic person who is interested to read, understand, and then ultrasound, you have decent ultrasound skills, you can go to 6 months 1 year training, work with some stalwarts, and then you can start your fetal medicine practice. Then comes our oncology. Okay, see, oncology is a branch where you need a very good setup and you need allied branches, like you should have a general onco or gastro backup, urology backup sometimes, and you also need a uh, medical oncologist, a radio oncologist backup, and practicing in a semi-urban or a rural area with oncology would be difficult. Okay, so you should choose, if you are already a very good surgeon, daring surgeon, and you want to practice in a higher center or a corporate setup or a medical college, then yes, oncology is the branch. Again, as I told in the previous minute, that you should have the temperament. You should have a heart of a lion and at the same time a tender heart, to be able to compassionately, passionately talk to the patients and take them through their illnesses or recovery or sometimes even death. So if you have that kind of temperament, yes, oncology is a branch. Of course, you will have to train for at least, in my view, 3 years before embarking on gynae oncology department. Now there is a MCH training available, or some centers are still offering fellowships of 2 years. But I think about 2 to 3 years of good training is important before practicing gynae oncology. Okay, now another branch uh, is high risk pregnancy. Now, for practicing high risk pregnancy, especially medical complications of pregnancy, or medical diseases complicating pregnancy, again you need to be in a good setup where you have physician, surgeon, and then ICU backup, obstetric HDU backup, and all that. Okay, again some of the centers are giving fellowships, even FNB is available in high risk pregnancy. Some of the hospitals give informal training in high risk obstetrics, like you go, you work with them, and then you come and practice high risk obstetrics. But all of us who practice obstetrics can have a exposure of high risk obstetrics, because any case can become high risk obstetrics, right? Like you don't know which case will turn out to be a problematic one. So you should all have a basic training in high risk obstetrics, but any center who has multiple consultants working under them will have a high risk obstetrics. So finally, take home messages: what you should do, it will depend on where you want to practice, what is your aptitude, what is your attitude, both are different. Okay, and what is your spouse also, that is also very important. If your spouse is a super specialist cardiac surgeon, then you can't practice in a small place where there is no cardiac surgery. So it depends like that. So many things are there. So you sit down, write everything what you want to, then accordingly train. Last tip I want to tell you all is that I suggest, first after your MSOBG, work for at least 1 year. 1 year in a place where they are doing everything. Okay, you work in high risk obstetrics, you work in obstetrics, you work in laparoscopy, you work in fetal medicine, you work in IVF. You get the gist of the things. First acquire a good general skills. You should be able to do your own scans, you should be able to do a little bit of laparoscopy, you should be able to do instrumental delivery and high risk obstetrics. And then once you know where you are good at, that is what the path is chosen. Remember, you cannot have shortcuts. There are no shortcuts. People who tend to do a crash course, 15 days course, 30 days course, end up getting into very big complications and getting into trouble. Mentorship should be lifetime. Okay, it will not end with just 1 year, 2 years, 3 years of training, because you keep talking, keep learning from your mistake, keep learning from somebody else's mistakes, and then keep advancing. Okay, do not imitate someone, do not see somebody and then just fall in prey. Do not be in a hurry. Your life, you have long life ahead. Plan properly, and then wish you all the best. Okay, thank you very much for listening till end.